was hoping she might do.
All right, Chris, the floor is yours.
Okay, thanks, Katie. And likewise, we've been thrilled with our partnership with the Mass Brewers Guild, which is why we keep continuing it. We've had success with several brewery members moving over to Aetna to look at their health insurance plans. We've had people also reach out just to kind of get general guidance from us on the health insurance market, which can be a very tricky industry if you're not familiar with it. I personally have 25 years of working in Massachusetts in the industry. So even if Aetna is not your fit, I'm always happy to provide some guidance or advice to the MBG members. But real quick, Aetna several years back started this partnership. One of the reasons why is we found with our products, one of the best fits we were finding up in Maine was a lot of brewers were moving over to our product because it's a little bit more based on your health of your employees and your overall group. And we were finding that breweries as a whole were very healthy, still needed health insurance, still wanted health insurance, but were kind of getting lumped in and pooled with everyone else as far as the pricing. So we were able to do some things that were to give preferential pricing to breweries. And they've been running very successfully with us up there. And now, 5 years later, as Katie mentioned, we've been doing the same here in Massachusetts. So it's a win-win partnership. I think we're able to provide some great products and pricing. And for us, I would say working with the Brewery Guild has been also enjoyable. It's nice every once in a while when you can mix in dealing with very nice and fun and friendly people into your workday. Real quick, our plan that we rolled out is called Aetna Funding Advantage. It does use some of the rules of self-funding, not to get too technical, where we look at your group and price you more based on your own merits as opposed to just putting you in a pool with everyone else across Massachusetts. So that's where you see some of the price savings. So who's eligible? It starts with the way we're filed for the insurance in Massachusetts with you have to have at least 2 employees on the plan. Currently, they can't be employee and spouse that are both the employees unless they have a third employee that might be waiving. So it's 2 employees on the plan. We go all the way up to 100 for this product. If you happen to be over 100, we do have products as well for the over 100 market. Participation. Sometimes it's tough to get employees to come onto the plan considering they have to share in the cost. And health insurance as a whole is very expensive. We have lowered our participation minimum to 20%. So, for instance, if you have 10 eligible full-time employees, we're going to look to get 2 of those employees on the plan. If the other people have coverage through a spouse, coverage through Mass Health, are waiving out their coverage, we will still write the group as long as you're meeting that minimum participation of 20%. So what's available? Key notes to make. These are lower cost plans on general, as far as their monthly premium that you're paying. And then we have a multitude of plan options as far as deductibles, copays, kind of the member cost share, as we would call it, for when you do use the plan. How much do you have to pay and how much does the plan pay? Particularly for us, the deductibles range from no deductible being a very rich, a little bit more costly plan, all the way down to a $7,500 deductible, which can be paired with a health savings account. So there's lots of options, lots of flexibility, because we know not every employer is created the same and not every employer has populations with the same needs. So the first thing that always comes up when we talk to employers is network. Are my docs in the plan? And I'm happy to say for all the carriers I've worked through in my career, Aetna, being a national company, has one of the largest, if not the largest, provider networks out there. It is nationwide. It basically works like a PPO, if you've heard that term before, preferred provider organization, which means you have access to doctors across the country that are in network. And essentially, you would be paying the applicable copays, deductibles, depending on who you see. So some networks out there will offer you more of an HMO model where you have a primary care physician who's a gatekeeper, and you have to get referrals to go to specialists from them, and they're kind of the quarterback of your healthcare. You can still do that on this plan, but it gives you more flexibility to seek care where you'd like to seek care. If you travel, if you have dependents or kids in college in a different state. It's more of a premier level of access across the country. So the good news is if you're on a plan right now and you're worried, well, what if we switch? I don't want to lose my doctor. That is not going to be a concern for you because it is one of the bigger networks out there for many health insurance companies. Behavioral health network. So the aforementioned COVID that Katie dreads talking about, one of the things that I think Aetna did coming out of that and during it, which was really critical, was to double down on our efforts to expand our behavioral health, mental health network of providers. Since 2023, you can see there was a 31% expansion in providers available. We've also rolled out very important telemedicine access points. That was another lesson learned going through that, where not everyone was able to get in to see a doctor in person. And ultimately, employees have now embraced this. For those of you in this industry, I think you can relate to the telemedicine piece from the fact that you're not working your standard 9 to 5 business hours. So sometimes people don't always have time during the regular provider schedule of access to get in and see their physicians or talk to a mental health provider. So we've really doubled down on making sure we get people more providers to access and also different times of day and different times of night where they can actually get the help they need. Ultimately, these things for you as an employer are going to give you happier employees, healthier employees, which keeps them more productive at work, which makes for a better work environment and a more stable workforce for you and your company. Just real quick to show you some of the different groups that we work with. Again, we're owned by CVS, so the Minute Clinics are available for access, but a lot of these other mental health, behavioral health provider groups have popped up over the last few years. And they've worked with things like substance abuse, depression, anxiety, eating disorders. There's all kinds of things that you can get access to around the clock. Okay, I mentioned before, not every group has the same needs. Some of you might have 30 employees. Some of you might only have 3. People have families. Some people are single and in their 20s. So for you as an employer, it can be very hard to try and figure out, how do I pick a plan that suits everyone? Katie alluded to it earlier. If the Brewers Guild were to try and get a plan for all the different employers, it's a lot of responsibility. It's a lot of pressure to make sure it goes well. And if it goes in the other direction, it's a lot of of aggravation for everyone. So what's nice about us is we have the ability to customize to what fits you. Again, different plans at different levels of price point, at different levels of deductibles. So for instance, if you have a group that people are looking to access providers more and they go to the doctor more frequently, they might want to lower deductible so they're not paying out of pocket when they go to the doctor as much. But if you have a younger group that seems like they never go unless it's an emergency, they can afford more of a $4,000, $5,000, $7,000 deductible plan where essentially you're making sure you're covered for the emergency, but you're paying less out of pocket on a month-to-month level. Prescription drug coverage, again, we're owned by CVS. Doesn't mean you have to only use CVS, but there's some unique value that comes along with being a CVS health company. We have, again, put some extra emphasis on behavioral health, mental health, and virtual care. To that end, we do have benefits that include a $0 copay. So if you're going in for mental health visits, those would track just like your annual physical as a $0 health copay. We also have $0 copays to get access to virtual care, virtual primary care as well. Recently, we've added some new plan designs in Massachusetts. We call them our premier plans or our zero lab and x-ray plans. Again, for someone who's looking for a richer plan design to attract better employees, there are some options for you to customize what fits best for you. Sometimes people pay a lot of money for the insurance out of their monthly contribution, and then they go to the doctor and they feel like, I'm also getting hit with all these extra costs at the doctor. With our plans, you do have the ability to find where's the sweet spot for you where you can get your monthly premiums as low as you can, but also offer good benefits when they do use services. Okay, talked about in-network behavioral health. Again, primary care is covered in full for your annual visits. You can also use CVS virtual primary care. Sometimes it's hard to find a primary care physician in person that has an open panel where they're still seeing new patients. What's great about this is you can go online and see people now. People are much more comfortable with that. For minor illnesses, you can also access the virtual care. You can also access the CVS Minute Clinics within the CVS locations at a $0 cost. We've also rolled out this $0 cost sharing for things like our preferred diabetic benefit, which comes with a no-cost glucose meter, as well as within a CVS, if you're going to get your prescription filled, you have access to get CVS brand items for up to $140 a year. You get a credit to go in there and get particular items checked off your list. To that end, so this over-the-counter benefit, it's one of the, we have multiple unique benefits, but I wanted to highlight this one because people seem to really appreciate this. It's $35 per quarter for the employee on the plan. They get to go into a CVS. In this instance, it's Marie. She's got the flu. While she's picking up her script at the pharmacy, she decides to get a digital thermometer, some sore throat spray, and a cold and flu pack of soft gels for 48 count, totaling $31. At the cashier, she's able to go up, show her Aetna card. They look up her ID number in the system, and they're able to take that $31 off her quarterly $35 credit. She's walking out of the store without ever having to swipe her credit card. So you're paying a lot of money for if I have to go to the doctor, if something bad happens, but you're also getting a lot of extra benefits that go with this. So I know sometimes people think, well, I'm healthy and I never go. Why am I paying all this money? There's some nice perks that come along with most insurance plans out there. And these are definitely unique to Aetna. Another unique piece that's been in play for a while now is when you move over to Aetna from another carrier, or if you sign up as a brand new company who's never offered health insurance, one of the things we try to do is give you an incentive up front. And rather than just lower your price so that it's not sustainable going forward, what we try to do is give you a credit. Right now, it's a $600 per subscriber or per employee coming on the plan admin credit. That amount would basically come off your second bill with us. And this is unique. We are doing this extended admin credit for the Mass Brewers Guild members and any affiliate members that might be interested in joining the plan. So again, as part of your membership with the Mass Brewers Guild, there's definitely a lot of perks out there. I've sat in a lot of meetings and heard some of the great programs. This is an additional one that comes at no extra cost. In fact, we're giving money back to you. Right now, this is going on. It's scheduled to go out to March of next year, but we've been doing this for a few years now. Sometimes the dollar amount can change, but I would foresee for the near future, this $600 per employee coming on the plan, staying for a while. We usually extend it. Okay, and last but not least, before questions, and again, we try to keep this brief for you guys because we respect your time and we know you're trying to do a lot of different things. There's different ways you can reach out to us after this call. The first would be the obvious one, which is to me. Again, my phone number is listed here. That's my personal cell phone. My email address, richiec@aetna.com. Feel free to reach out. I know I've heard from some of you in the past. The other piece of this is most employers work with an insurance broker. In fact, all of our business that comes in has a broker attached to it. What's nice about this is you're not paying the broker directly unless you're using other non-medical services. The insurance companies build it into their pricing overall and have a payment for the broker to be basically a personalized advisor for you as far as looking at Aetna, looking at other insurance carriers, and then talking to you about other benefits that you might want to roll out to your employees. So if you have a current broker, reach out to them, make sure that when your renewal is coming up, or even if you're looking to find out more now, that they're reaching out to Aetna. They know how to get quotes from us. They should be showing this to you every year just to make sure you're on the right plan with the right pricing. If you don't currently work with a broker, I can certainly make recommendations. I work with hundreds of them across Massachusetts and New England. And depending on where you're located or what you're looking for in particular, I can help narrow it down and make sure I connect you with good people, most of all. And then last but not least, we've got the Mass Brewer Guild Con coming up at Jack's Abbey in November. We're going to have a table there. We would be thrilled to have you come by and say hello. And certainly we'll have a couple people there at the table available to talk to you about your specific needs. Again, any general questions about the state of health insurance, what you're looking to do for your team, or just what you're trying to deal with personally, we're thrilled to be able to offer advice and help get you in the right direction. And with that, I think we can open it up to questions.
Bueller.
which is totally okay if you don't have them today. It's a little bit like drinking from a fire hydrant with this stuff. Again, I try not to dive too deep into any of the particular topics, but happy to jump on a phone call or even do one of these with you personally. And if there's any specific sections of this that appeal to you, happy to dive in and spend as much time as you need.
And I did see that Sarah unmuted, so
Yeah, I was just going to say, I have a whole host of questions, so I've already started an email to you, so don't worry.
Beautiful. I love that.
We have a question from Randy in the chat. Owner funding options, bunch of letters versus 100% company funded.
Yeah, so I'm going to have to take that back and look into it. I think, Randy, you were a one person shop, right?
Yeah, I'm a one person S corp. The bunch of
Yeah.
letters is the qualified self-employed health reimbursement arrangement, which is a strategy for funding these kind of health things through an S corporation without it being taxable compensation.
Yeah.
But then again, it goes up against the 2% S corporation ownership rule, which makes it company funded. And you could also just have the company pay the entire invoice directly for the owner. That'll avoid the FICA taxes, but you're still subject to federal income tax. I didn't know if you had any of those kind of strategies like, oh, S Corp owners should do this.
Yeah, I think for me, and I think I had mentioned this, I'm going to try and find someone in the broker side of things who deals with more of the sole prop groups. Just because for us, our primary focus is employers of two or more. So we don't really, unfortunately, it doesn't, you're not technically eligible to come on our plans based on what we file with the state of Massachusetts. So we don't really have a lot of products or guidance out there as far as the one lifers. But certainly if you get to two, we've got a lot we can talk to you about. But in the meantime, I do have some guys I've worked with throughout my 25 years who aren't afraid to get their hands dirty on the one lifers out there and give some guidance. So I'll see if I can connect you with somebody. I think that would work well for you.
And also not just me personally, but some of my clients have like partnerships set up. So I'm trying to think of ways to help them be more tax efficient. And I figured that you or the person you connect me with might have good answers.
Yeah, no, 100%. I think given what you do, certainly to get you a good resource for guidance for them, that's the thing is, no matter how you're connected with employer benefits or employer needs, it all kind of blends together at some point where people are just looking for help and guidance to get to the finish line on what they need. So we'll definitely be in touch. I've got your email. I'm going to try to get the right person connected to you who's going to actually give you the attention you need on this.
And if those answers, Randy, are helpful in a more broader context and they want to turn into like a newsletter blurb or some sort of blog, I don't know. Who knows? We'll see where the answers go.
Yeah.
Because I know that if you're having these questions, obviously our members are too. So.
And a kind of related question that's in the news right now is about the Affordable Care Act subsidies through the marketplace type things. I know that Aetna, being a privately purchased group plan, wouldn't necessarily have those. Then again, we don't even know if the subsidies would be available through the marketplace. How does Aetna interact with the marketplace at all? And is there any advantage to a company having a private plan like through Aetna versus just giving their employees funds to go purchase individual plans on the marketplace?
Yeah, I mean, it's definitely been something to, and again, I've been doing this a while, so I've seen all these iterations of attempts to try and make things more affordable and attempts to make things more accessible for people. Historically, I worked in the fully insured side of things, the ACA side of things, which is the 2 to 50 market, where again, it's a little bit more government regulated on price. Some of those programs offer some, premium relief depending on how you're accessing, whether it's as an individual through the exchange, and that's an ever shifting, swaying back and forth pendulum at this point. And I think what we've done historically with us from a group perspective and selling group insurance is we've started to shift away from that. I came on here about 8 years ago where we started looking at groups more on an individual self-funded basis. This AFA plan it lives outside of the ACA rules and regulations. So it allows us to price you based on your own merits, and it doesn't lump us into some of the taxes and regulations and fees that go into the more government regulated plans. Certainly there are some states and marketplaces where we may still have those type of plans available, but kind of over the last few years, Randy, we've seen more of those states. We used to have it in Connecticut, then it got down to 2 plans in Connecticut on that level, and now we've just completely gotten out of that. New York, we just filed to pull out of New York for 2 to 100 starting 1/1/2026 because of some of the regulations and the impact it has on overall cost and what that would mean to any members trying to come on our plans. The plans are basically becoming almost unaffordable. So what we've done with this plan is said there's a different way to do this. Self-funding regulations allow us to price it a little differently. It's still regulated per se. It gives us more flexibility for employers. It's unfortunately not a fit for everyone. If you have a very unhealthy group, this isn't a great fit for you as far as pricing goes. But I think what we're finding is a lot of groups are kind of paying more than they need to. And by going through this program, we're able to show them some savings. But there is also the mindset of give the employees money, let them go out and fund their own plan, and you're giving everybody a set contribution. I think the biggest issue there is just the education piece. You're relying on employees to be able to take care of themselves in the way they need to, and you're hoping that they get the right guidance or they take the initiative. And truthfully, some of this comes back to, how much do you want to make sure your employees are, healthy and happy and able to work, be productive workers. And a lot of times when they're left to their own devices, they don't always, make the right decisions or find the right fits that make them happy. So we've seen people do that. Ultimately, employer-sponsored healthcare, at least in my opinion, has led to, much more, satisfaction as far as getting people what they need. But ultimately, it still is always at odds with overall cost, which is a struggle for every employer group and even employees that are on the insurance. It's still a very high cost coming out of their pocket every month.
Right. And one final thing for you on this, Chris. You just said that the plans, because this is technically a self-funded plans, is exempt from some of the requirements of marketplace plans.
Yeah.
Do these Aetna plans still meet the minimum credible coverage or the minimum essential coverage for health insurance plans? It's not one of those profit sharing scams that some of the religious organizations engage in?
Yeah, so the MCC requirements, what's nice is we have a national portfolio of products. However, we have a separate Massachusetts portfolio of 18 plans. And the reason we carved out Massachusetts to have their own plans is so that they would all be certified MCC compliant. So they are certified MCC compliant. There are 1 or 2 plans that are not Medicare, compliant as far as like that $7,500 HSA plan. If it's paired by itself, doesn't meet that compliance level for Medicare minimal credible coverage, which is a different type of credible coverage. Not to get too in the weeds here, but you have the ability to find plans that meet that. But as far as mass credible coverage to get your 1099 and be in compliance with the regulations, all of these plans will satisfy that. So there's no worry there.
Excellent. Thank you.
Yeah. No, great question. Not one you normally get unless you're getting it from someone in the industry, for sure. And unless anyone has anything else, again, I want to be respectful of your time. I know we carved out 20 minutes or so here. I really appreciate the questions and the partnership. We love doing the live events because, again, like I tell everyone, every event I get to speak at, talking insurance all day can get a little bit stale. So I'm sure, you guys are gearing up for the end of the year here and have a lot going on, but certainly reach out to me if your insurance renewal is coming up, or if you're looking to just start exploring it now. We've got plenty of time to jump on the phone or on a chat and get you everything you need.
Excellent. Well, look forward to the novel that Sarah Real is sending you via email. And thank you, Randy, for the great discussion and questions. And thank you all for joining this morning. We hope to see you all at MBG Con on November 3rd. So see you there, Chris.
Thanks, everyone.
Cheers.
Thank you all.